wrinkles disappear. Botox is a woman's best friend.
And a man's. Now doctors have found a new use for the muscle relaxer, and it is giving ladies like our next guest a lift.
Over time, things fall.
Maureen Counselor is not happy with her chest.
I'm 38. I've had 2 children. Things just aren't the same as they were once before.
Like some women, she's fighting some sagging.
I'm not that big to begin with, so it just accentuates that problem.
She wants to wear a tank top without a bra and be a little bustier in a bathing suit, but going under the knife right now wasn't the best option.
I decided not to have surgery right now because of the downtime, because of the time of year. It's summer. I just want, a nice, easy, quick fix.
Having previously indulged in Botox injections in her face, she turned to the web to see if that could be a solution.
I was actually looking on the internet to see what I could do other than, just have it in my face.
She came across a procedure called Botox breast lifts and inquired about it to her plastic surgeon, Dr. Stephen L. Davis.
Conceptually speaking, it's the same no matter where you inject it, in that the muscles that you're injecting weaken.
During the procedure, the pectoral muscles are injected with Botox, which relaxes them. This causes the back muscles to overcompensate, arching the women's backs.
It actually causes the patients to have a better posture, lifting their chest up, which is causing them to have a breast lift. Hi, Maureen. How are you?
Good, Dr. Davis. How are you?
Fine.
Maureen signed on and was brought in for the procedure.
I'm going to have you push against my hand with your hand, just like you're doing like a push-up.
Okay.
And there's that muscle grouping right in through here.
First, the area was numbed. Then the doctor does 3 injections of Botox on one side and 3 on the other. And within minutes, it's over with.
That's it.
Cool.
How you feeling?
Fine. I'm so excited to see the results. When I look good, I feel better. And it's going to help me to have a little more confidence in myself, look better in my clothes, and I can't wait to see what happens.
Please welcome Maureen. She's here today, and the doctor who performed the procedure is here as well, Dr. Stephen Davis. So, Maureen, pardon us for looking at your breasts, but, it's the way it's got to go here.
I understand.
Are they perkier? Are you
Yes.
feeling that they're perkier?
Oh, absolutely, absolutely. I just feel like my clothes look better. Everything, is just a little lifted. I feel like my posture is so much better. I'm not any bigger, but I'm definitely lifted.
No, well, I mean, I'm not saying that in a rude way, but look at that. I see a little bit of it. But, doctor, what's really going on here? You have not really lifted her breast.
No, and I think that's the concept that everybody at home and everything should really be taking away from this, is that Botox, just like if we're injecting it into the face, is supposed to be putting certain muscle groups to rest, which allow other muscle groups to take over.
So her back muscles are taking
Exactly. So the back muscles, the rhomboid muscles, the muscles that kind of support the shoulder girdle, are now working unopposed, which causes a postural change.
Do you feel like your back muscles are working overtime?
No,
really?
but I just feel myself standing up straighter. You know how when you try to sit and stand up straight or sit up straight, it's just happening.
Why? Why don't you just stand up straight and save yourself $1,000?
Well, I mean, you really could do that, but then you have to think about it all the time, and this way, it's I guess I'm kind of lazy that way.
I understand if you put a little Botox in your face, those muscles aren't very big at all. You paralyze them or relax them.
Right.
But the pectoral muscles, isn't that going to take a lot of Botox?
That's why you have someone that looks like Maureen that gets it done and gets a result. So when you go to your doctor, hopefully someone who's really been doing a lot of Botox and understands the anatomy in that area, what you're really trying to do is say, if you're coming in and you're about an A cup, you're built like Maureen is, you're probably going to get a very nice result. Someone that comes in that may be a lot larger, not just volume in terms of cup size, but I mean because you can't put those muscles to rest,
Because it would be dangerous to have that much Botox in you?
Yes, and also you're a bad candidate for it, so it's like a combination bad thing. You know what I mean? Even if you put that much Botox in, which is bad, it's not going to work because that person has such pendulous breast, you're not going to be able to lift it up.
Ooh, we asked Allergan, the company that makes Botox, what they thought about using Botox for breast lifts, and here's their response. Botox cosmetic in the breast area is an off-label use, meaning that this technique has not been validated or approved by the U.S. Food and Drug Administration. This is not implying that it is dangerous, just that it has not gone through the rigor of the FDA review process, which evaluates drug safety and efficacy for a given use. Now, does that mean that they're basically taking themselves away from any sort of legal?
A lot of things that we do in medicine have to do with making sure the patient understands when they're signing consent forms that you're allowed to do these things, even though the FDA may not have approved that specifically.
Doctor, thank you.
You happy?
Absolutely.
All right. That's a
Beautiful woman.
Thank you, guys.